3 weeks after we carefully removed one tooth, Melissa said, "Guess what? I don't need my blood pressure medication anymore." Now, she hadn't started a new drug or changed her diet. We had simply removed one pain-free, infected tooth. Hi, I'm Dr. Chuck Reinertsen, founder of the Dental Medical Convergence. After 40 years as a dentist, I've seen what happens when physicians and dentists don't talk with each other. Now, Melissa was a nurse taking blood pressure medication every day. She visited her physician, they took her blood pressure. It was high, so her physician put her on some medication to control the blood pressure. He thought that would be the end of it, except it wasn't. Let me show you what nobody thought to check. There are over 700 species of bacteria living in your mouth right now. Most are healthy, we need them. There are about 20 species that are harmful to us. When you have infections in your teeth or gums, the harmful bacteria enter the bloodstream. From there, they travel everywhere your blood goes, including your heart, brain, pancreas, liver, kidneys, and lungs. You don't need to be a physician to know that's not healthy. A 2024 review in Frontiers in Immunology documented how these oral bacteria contribute to cardiovascular disease, diabetes, rheumatoid arthritis, and even Alzheimer's disease. Researchers have even found gum disease bacteria inside the clogged arteries of heart surgery patients, meaning the bacteria that started in someone's mouth ended up in their heart. That can lead to a heart attack. When we did a complete dental exam on Melissa, including radiographs or x-rays, we discovered her lower left second molar had a severe infection. There was so much bone loss around the tooth that it could not be saved. Melissa was shocked when we showed her the x-rays. How can that much bone destruction not hurt? She had absolutely no idea because she had never felt any pain. 90% of dental infections have no pain. It shouldn't surprise us. Neither does high blood pressure, diabetes, glaucoma, or the early stages of cancer. Lack of pain doesn't mean you're infection-free and healthy. The number one reason people don't see a dentist isn't because of pain or expense. It's because of lack of pain. Nothing hurts. I'm fine. I don't need to see a dentist. People believe they're healthy, but they're not. What was actually happening inside Melissa's body was simple. Her body was fighting her dental infection through inflammation, which in turn was driving up her blood pressure. Her physician never made the connection to her mouth because he wasn't trained to. Her physician never checked or even considered her mouth as the cause of her high blood pressure. Now, your physician wasn't trained to check your mouth either, and your dentist wasn't trained to tell you about the diseases that are caused or worsened from the harmful dental bacteria. It's not their fault, but it does mean that nobody is helping you connect the dots between dental infections and their medical consequences. In 2024, a consensus report in the European Journal of General Practice called for family physicians to start managing periodontitis, which is another word for gum disease, as a systemic condition because of its independent association with cardiovascular disease, diabetes, and chronic obstructive pulmonary disease. But that hasn't happened yet. So until it does, you have to be the one to speak up. The next time you see your physician, ask him or her if your dental health can affect your medical health. If they don't know, it's not their fault. They were never taught the oral systemic connection in medical school. Now, the next time you see your dentist, ask them if there are any diseases caused or worsened by dental infections. Again, if they don't know, it's not their fault. Most dentists were never taught the significance of the oral systemic connection. It's up to you, the patient, to make this common sense connection. Because right now, nobody's having that conversation with you. And here's what makes Melissa's situation even more eye-opening. Her blood pressure medication was actually making the problem worse, and nobody had a clue. Blood pressure medication causes xerostomia, which is another word for a dry mouth. Now, when you have a dry mouth, you don't have the saliva to dilute the acid that's being produced by the harmful bacteria. So your teeth deteriorate faster and your gum disease gets worse. This process sends more bacteria into your bloodstream, which drives up your blood pressure, which means more medication, which dries out your mouth even more, It's a never-ending vicious cycle. Now, we carefully removed Melissa's pain-free infected tooth. 3 weeks later, her blood pressure was back to normal without any medication. So what should you do? I've got 3 tips for you. The first thing you can do is spend 8 to 10 minutes once a day thoroughly cleaning your teeth. That's at least 4 minutes of brushing and 4 minutes of cleaning in between the teeth using intraproximal brushes, directed water irrigation, or floss. It costs you nothing, and it makes a bigger difference than most people realize. You can't complain about the expensive dentistry if you're not even doing the free stuff. Next, share your dental concerns with your physician and share your medical concerns with your dentist. If you don't start that conversation, nobody will. Last but not least, get a complete dental exam, including radiographs or x-rays, not just a cleaning. And when you're there, don't just ask if everything looks okay. Ask your dentist to check for infections around any old root canals, crowns, or fillings. Do my gums bleed when you probe them? How deep are my gum pockets? What do I need to do to have a healthy mouth? If the truth be told, Melissa was lucky. We found the issue impacting her health and addressed it. But most people are still walking around with pain-free dental infections they don't know about. You'll feel fine while your body fights a silent infection battle. Now, if this information helps you, please hit like and subscribe and share. Someone in your life might be taking medication right now for a problem that's actually starting in their mouth, and they have no idea. One more thing. If you've seen your own health improved after addressing a dental issue, share your story with us at stories@thedentalmedicalconvergence.org. Every story we share helps someone else connect the dots between their mouth and their health. Now, if you want to understand all the hidden connections between your mouth and your health, check out my book, Are Your Teeth Making You Sick? It's on Amazon. Now, in the interest of your better dental, medical, and cardiovascular health, I'm Dr. Chuck Reinertsen. Thank you.